chairman of this occasion, members of the high table, distinguished colleagues, ladies and gentlemen, permit me to stand on the already established protocol. I've been given a topic that is so large, and I want us to listen very attentively because it's going to benefit us personally as well as our patients. The topic is balancing optimal therapeutic health outcomes with essential nutraceuticals. Just like Dr. Teresa just said, the bane of all the diseases in the whole world is malnutrition, especially chronic non-communicable diseases. It's malnutrition. Because if we do a test in this hall now, I can assure you 100% that we are all minority. I know what I'm talking about. We are all minority. Because of it. Your system is converting your testosterone to estrogen. Then we are all minority. So I want you to listen attentively. It's an interesting topic. And the only virtue that separates a pharmacist from other healthcare professionals is the depth of your knowledge, your versatility, your capacity, your skills and competencies on drugs. By drugs, I mean including nutraceuticals. Because the profession of pharmacy cuts across the entire spectrum of the healthcare system. So we need to go back to an ongoing thing because we've done a series of systematic analysis and reviews. Most people are minority. So let me lay a foundation for this presentation. Sorry, there's no slide. I forgot to note political pharmacist. Nutraceuticals is a term that is coined from two words. Nutrients that provide nourishment in addition to having some active pharmaceutical molecules that enhances well-being, good health, and deter diseases. It was coined by Dr. Felici in 1989. Sorry, Dr. Felici in 1989. And it's two words, nutrients and pharmaceuticals. That is what is known as nutraceuticals. And nutraceuticals is the bane of maintaining healthcare. So you have nutraceuticals in form of food as well as either isolated pharmaceutical bioactive components which you can use. They also include the term functional foods, and they are classified into various classes. You have health supplements, you have botanicals where they come from plant sources, you have the probiotics, they all belong to the same class. You have the prebiotics and the postbiotics. Then you have the phytochemicals. For instance, the polyphenols in green tea, ECGC, epigallocatechin-gallate. You have the parallel-quinolone, PQQ. They are there. I don't intend to take you back into too much scientific whatever, but we need to understand the basis before we go ahead. Now, all non-communicable chronic diseases evolve from four major factors. Four major factors. Number one, deficiency, which takes me to malnourishment. Deficiency. The foods you are eating, are they okay? Do you get the necessary nutrients from that food? Our agricultural practices have depleted our soils of major macro and micro elements. Do you have the right vitamins in these products? After taking antibiotic treatments, do you replace your microbiome, your gut? Because about 80% of your immune system starts from your gut. 80% is from your gut. The microbiome are responsible for the synthesis of some of these hormones. Your melatonin, your serotonin, your sleep hormones, well-being hormone, oxytocin, microbiome. But when you take antibiotics, you sweep them out. You now become deficient. The next factor is consumption pattern. What do we consume? I can see on the high table, exotic fruits, sugar, fructose corn syrup, maltodextrin, spikes your insulin. Then we start talking about insulin resistance, smoking, alcohol, environmental pollutants. So consumption is very important. The third factor is your lifestyle. Are you sedentary? Are you active? So these are some of the issues that affect some of these chronic diseases. Now, going back to the main topic, having understood or discussed the issue of nutraceuticals, how do we balance optimal, positive health outcomes with nutraceuticals? In the first place, we need to understand the class of nutraceuticals, like I said, including phytochemicals. So when you're taking green tea, taking black tea, taking raw cocoa, you are taking nutraceuticals because they contain active pharmaceutical bioactive components. When you're taking what we call ugu and other foods, they are part and parcel of nutraceuticals. When you take isolated, synthesized multivitamins, the fat-soluble vitamins are the A, D, E, K, or water-soluble vitamins, vitamin B1 up to B12, up to B14, and C. Do you actually get them? How do you optimize this? I'll just give a few examples because of want of time on the importance of some of these nutraceuticals. With respect to certain diseases, a lot of people have been maintained on antihypertensives. Many people have been maintained on antihypertensives. The issue is that have we bothered to do what they call a root cause analysis? Because we're taught that primary hypertension has no cure, it's of unknown origin. But we now know the origin. And it's been reversed once we have the knowledge. Number one, there's a very important mineral without which life is still up. It's involved in more than 8,000 biochemical reactions in the body. And that mineral is potassium. Potassium. The average daily needed allowance is supposed to be 4,700 milligrams. 4,700 milligrams is involved with the sodium-potassium pump, involves several biochemical reactions as a cofactor. Your heart can stop without potassium. Your muscles will not contract without potassium. Several things. But the point is that more than 80% of the whole world is deficient in potassium. And that is why they always campaign that you reduce salt intake because they are supposed to be in a particular ratio. You can't get sufficient potassium. However, you can eat foods that contain high level of potassium. For instance, sweet potato, especially brown, sweet potato, banana gives you potassium, almond gives you potassium. Once you're able to balance that particular ratio, you solve that problem. Now, secondly, when you take milk, calcium, vitamin D3 enhances the absorption of calcium. But calcium in itself is the cement. Cement they use in building this house. Limestone. That's what calcium is. And it's supposed to be in our bones and teeth. Now, having taken these two, and the level of calcium is so high in your body, the calcium continues to navigate the entire body and start calcifying your organs. you have kidney stones, you have bladder stones, all sorts of stones everywhere. Now, calcium is ideally supposed to be in the bones and teeth. And that's why you see the elderly, when they start getting elderly, they start walking, stooping, then you see them emaciating because the calcium that they have is not in the bones. And they suffer fracture. Now, what do you do to optimize the nutraceutical? The natural calcium channel blocker is magnesium. Magnesium is a natural calcium blocker. Because when calcium gets into the transcellular space, magnesium pulls it out. It blocks it from entry. Now, what next are you supposed to do so that it doesn't calcify your organs and tissues? You must get vitamin K2 to direct it into the bones and the teeth. That's why I said the profession of pharmacy is a profession of deep knowledge. It's a profession of deep knowledge. You must always be at the tip of your whatever. So you must get vitamin K2. Vitamin K2, where do you get vitamin K2 from? Sour food, fermented sour food, like sauerkraut, nattokinase, that's the fermented soy. Most sour foods have vitamin K2, and that is why if you see today, a lot of preparations that in the pharmacy, you see magnesium, D3, K2 as a combo. Otherwise, you chase calcium out, it causes another problem. That's number one. So potassium has been involved in more than 8,000 different biochemical reactions. Secondly, if you look at sickle cell patients, they are normally being placed on folic acid. Folic acid. Now, if you go into epigenetics, the study of silencing genes without actually changing their form, histones, using acetylation, methylation, and phosphorylation, the kind of folic acid we have today in the pharmacies. Some people have, what do you call it, mutated NTHFR, that's methylene tetrahydrofolic deficiency. And NTHFR is the one that methylates the folic acid and makes it usable. Now, without methylation, you are giving the patient folic acid and he's not able to use it. The only solution is to get a methylated folic acid. And once the patient gets that folic acid, it silences the gene because it's the amino acid valine that is substrate of glutamic acid at the 6th position on the hemoglobin chain. So it silences the gene, just put it to sleep, don't react. That's what folic acid does. And the patient gets fine. But if you don't have methylated one, it doesn't work. So a lot of diseases is because of some of these details that even our colleagues, the medical professionals, don't even know. You look at vitamin B1, that is very essential in your Krebs acid cycle, tricyclic acid cycle, where cellular respiration takes place. You need vitamin B1, that's thiamine. And it's supposed to enter the blood-brain barrier to provide something for the brain. But the ones you have now, thiamine, the molecule is so big, it cannot penetrate the blood-brain barrier. So what do? What do? You get benfotiamine. Benfotiamine is one that's been prepared in a fat-soluble base that can penetrate the blood-brain barrier. So they are like that. The same thing with all the B vitamins. Some people have this deficiency, and most issues that have to do with hypervitaminosis is because the vitamin is in the system, but it's not available for the system to use because they cannot methylate it. They cannot methylate the vitamins. So it's a deep whatever. Number 3, look at selenium. Selenium is one of the most important minerals. People come up with goiter, whatever issues. Even metabolism. You eat food and the food is not metabolized. What is metabolism? Metabolism is catabolism and anabolism. He breaks it down and builds up. How come the food you eat is not metabolized? And it stays in your system. And you start looking bulky. In African palace, they say they are enjoying it. Meanwhile, you are carrying bodies all over. If you look at my stomach, you understand? Selenium, the thyroid gland that secretes T4 needs selenium to be converted to the active form T3. Without selenium, you don't get it. Where do you get selenium from? The highest point is Brazil North. Just one a day. So all these things, the pharmacists need to know the complexity in this whole thing. Now, Hashimoto thyroiditis, how does it happen? Hello? Hashimoto thyroiditis, how does it happen? Because the thyroid gland is a machine. It's a machine that is responsible for so many reactions. In that process, it generates free radicals, raw, unpaired oxygen radicals. And if it is not clear, it goes back to attack the thyroid gland. And that's what they now tell is an autoimmune disease. So it's deep. So pharmacists need to up the ante to know the complexity in this whole issue. Because if it's not the pharmacist, who will go deep into all this? Now, the green tea that you see is one of the most potent phytochemical. Green tea, in fact, recent research, green tea has been used as part of an adjunct to treat cancer. Green tea, it contains ECTC, epigallocatechin garnet. And very potent antioxidant. Because when we did a systematic review, and we looked at why is it that Japanese, they have lifespan, 120 years, 150 years. What is the secret? We realized that they don't go to phytochemicals. Green tea, black tea, raw cocoa is part of an everyday meal. Because the greatest thing that leads to chronic diseases is oxidative stress. Oxidative stress. As I'm standing now, my body is functioning. Estimatedly, I have about 37 to 40 trillion cells in my body. And they are working 24 hours. The mitochondria, the powerhouse, is busy generating energy for the body. The heart alone has an estimated more than 100,000 mitochondria. The brain also. And that's why when your level of sugar is low in the brain, you get single. And just go down. In that process, free radicals are generated in trillions in your body. So if you don't have antioxidants to quell all these free radicals, they go back to start attacking the cells. And that's where the problem comes from. Let me give us something about prostate. Prostate these days has become like something else. It's very common. You hear prostatitis, prostate cancer, and other things. Now, what is happening in essence now? There's a particular enzyme known as aromatase. Every woman, male or female, have testosterone as well as estrogen. Now, what the aromatase enzyme does is it assists the conversion of your testosterone to estrogen. So you can imagine a man having a high level of estrogen. Then the next thing, hot belly. You look at the face, mood face, all the activities start going down. Even though everything goes down. Everything goes down. Everything goes down. Because the amount of estrogen that a man is expected to have is just about 20%, and the testosterone about 80%. Now, by the time you reverse the entire thing, and that is what causes what we call hormone disruption. Hormone disruption. Now, how do you solve this problem? Very simple, very simple. How does it ever say? She's a specialist in this. How do you solve it? Number one thing, zinc prevents the conversion of the testosterone into dihydrotestosterone, which is a more potent form of testosterone, and which is the one that leads to inflammation in the first place. And when you get the complement of this, pumpkin seed, I bought some from the shop. I don't joke with it. Pumpkin seed. Pumpkin seed. I don't joke with it. And the last time I went for my PSA, can you imagine my PSA at my age? 0.5%. I took my elder brother's vote along the same sampling. His vote was more than 100%. I don't joke with it. Now, the other thing again you can do, this time that I said aromatics that convert your testosterone into estrogen, what do you need to do? You all know lemon. You know lemon. You know lemon. Now, there's a particular compound, phytochemical, in the epicarp of lemon. That peel, lemon peel, they call it salvasterol 940. Salvasterol 940. Easy, that one throw away. That's maybe. I take it every morning. Plenty, add water. And it prevents that enzyme from converting testosterone into estrogen. So I'm not going to grow fat belly. So you understand? So, and that's why I say, if you have an issue, pharmacists beyond dispensing oil is cheaper. If you Google my name now, you see some things of systematic review and meta-analysis. Because that's my hobby now, academics. Even though we call it bad science. So it's deeper, and each time I try to dig deep, I just noticed that the whole thing was like an ocean. Look at diabetes. Diabetes. Why would you say diabetes? They don't care what has to manage. But nobody is doing a root cause analysis. Why is that the insulin is so sensitive that it's called insulin resistance? And they now give you metformin to reduce the intake of glucose and glucose. Why is that? The cell is rejecting the insulin. Basic four chemical molecules. 4 minerals. Number 1, chromium. Chromium is in the pancreas. And chromium ensures that the insulin is well packaged. In such way that signaling that the cells will recognize. Number 2, vanadium. Vanadium, 3 magnesium. Then zinc. So if you have all these, why won't the cell open to accommodate you? And if your metabolism is working very well, whatever you take will be broken down and you extract the active component from your system rather than staying. So Dr. Teresa is here. She's spoken about the role of pharmacists in nutrition. And that's why I said I'm pretty sure 100% of us here we are minority. It's not quenching your hunger. It's not quenching your hunger. Hunger is not about whatever. It's what you have to ensure that your body continues to perform optimally well. So it's a deep field. I'm just giving you an example about few whatever. Even I'm telling you all diseases is a root cause. And the root cause gets back to nutraceuticals. And what actually prompted all this stuff was that I had an issue sometimes. And my brother was my God. I did everything possible. The place was export. At the time, the export is 60,000. Every month, 60,000. I said, this thing, it would work. And I said, And since then, I just noticed 125 over 80. 125 over 80, sometimes 120. When I started this book, I said, if I can get this from nutrition, why should I go to the, even though some of you may not like what I'm saying, because you need to sell extract. You understand? Same thing with a lot of products. So the research currently is to see how longevity can be attained beyond 40, 50, 60 years. Inshallah. But the most important thing is that the pharmacist is at the center of this whole thing. It is the function of the pharmacist. It is the job of the pharmacist to ensure that we do that. Because if you don't do that, nobody does it. Because when you see some prescriptions, you just wonder. When you are prescribing, okay, the methylated form I'm talking about, you have nicotinamide. Nicotinamide, rather nicotine. Niacinamide, rather niacin. Benfotiamine, vitamin B1, rather than thiamine. Then vitamin B12. There are 3 vitamins. They are very, very essential. Very essential. I want you to note. Very essential. Number 1 is vitamin B12. Number 2 is vitamin B6. Number 3 is B1. Now, you have 3 forms of vitamin B12. You have the cyanocobalamin, which is the most popular one, made out of cyanide. You know where they pick cyanide from? I'm on the TV, I'll talk about it. Cyanocobalamin. Then you have the methylcobalamin, which is the bioactive form of vitamin B12. Then you have the hydroxycobalamin. So, if you go taking cyanocobalamin, they are not in active form, and you expect any changes, you don't get anything. So the bioactive form is methylcobalamin. That form the body can easily use. If you go, the same thing with hydroxy, vitamin B6, the same thing with thiamine, benfotiamine. Look at a lot of people. Iron is essential for blood. You know what iron does? Exactly what iron does to iron you put outside, rusting, is what it does to your body. And excess iron has been implicated in oncology now, cancer. Because the cancer cells feed from the iron. Oftentimes you find that people are anemic. Iron deficiency anemia. Meanwhile, when you check their ferritin stores and whatever, the level of iron is high. Why? Because the body cannot utilize it. It's just sitting there. And what it does is to continue to rust you and cause you oxidative stress. There's what they call ceruloplasmin. Iron needs it to function well. Iron needs zinc to function well. Iron needs magnesium to function well. And it's not all magnesium. There are 6 different types of magnesium. But the best that I use is magnesium glycinate. Magnesium glycinate. Now, look at homocysteine. Homocysteine, because all cases of cardiovascular issue, the one that kills most is heart attack. Heart attack. Not the plaques. Not the plaques in the arteries. Now, how does heart attack come about? Because when you have high level of homocysteine, both HDL and LDL, what causes plaque are 3 things. Number 1 is the microorganism that has affinity for the endothelial cells. It attaches there, then it gets calcium as a cover itself. Then from there, LDL comes in and attach. Now you have 2 different types. You have the soft fluffy plaques and you have the hard one. It is when the plaques detach that it becomes problem. Now, how do you loosen plaques? Just provide necessary nutraceuticals. Number 1, vitamin K2. vitamin K2 loses plaques and clears your arteries, makes it free. It makes it free. And I told you I get vitamin K2 from natural kinase, fermented soil, and so many other things. Now, I'll talk about cruciferous plants. Cruciferous plants. They'll try to see a lot of patients have been on drugs for more than 2-3 years for ulcer. For ulcer. A lot of patients have been on drugs for ulcer. They'll tell you ulcer, gastrointestinal ulcer. And they tell you great minority. Do you know the cure? Do you know the cure? Do you know the ulcer? That ulcer, the top ulcer, is cabbage. Cabbage. I said cabbage. Cabbage contains a particular compound called sulforaphane. Sulforaphane. If you want to get the best out of cabbage, allow it to get fermented, but you won't like the other. Sulforaphane from cabbage, cruciferous plants. So the knowledge of nutraceuticals is something that is very rich. But like I said, the pharmacist should be at the center of these whole things. I don't joke with green tea. Mr. President, sir. Mr. President, I'll tell you one. When I go to play tennis, I play with younger players, professionals, like young professionals. But I normally knock them out. There's something I'm eating. This level of energy, because I can play at the strength of 6-7 hours. 6-7 hours of tennis. You see, it's consumption. What can we take? How can we ensure that we are optimal? Like I said, you see exotic fruits. Or are we going to talk about the issue of plastics, nano and macroplastics? They've been found in the testes. They've been found in the brain. Macroplastics, we're taking over from this now. At a particular temperature, you don't know the economic conditions. At a particular temperature, the chemicals leach into the water. And you take it. Meanwhile, your body does not have capacity to metabolize plastics. So what do? How do you remove plastics from your body? Can anybody tell me? How do you remove plastics from your body? Do you know the plant we call Stadia? Tamarind. It removes plastics from your body. It chelates it. So there are so many things. So that's why I define nutraceuticals to involve food that, in addition to the nutrition, have some active pharmaceutical compound. So your food can be your medicine can be your food. So it's deep. Because when you see people, sometimes when I sit down, I see elders walking as if. Do you know what's happening? The bone is looking frail. The bone is looking frail. And there's a particular ratio that iron and copper are supposed to be a ratio 8:1. Do you have that copper? You don't have it. Copper, you don't have it. But how do you get it? Raw cocoa, minimum 70%. No sugar in it. Otherwise, the iron in your body will continue to stay. So, a lot of phytochemicals. You talk about omega-3 fatty acids. Omega-3 fatty acids. One of the dangers now, one of the major dangers now that we have is consumption of ultra-processed seed oils. Canola, that's what we use in cooking. But this seed oil end up giving us what they call fatty liver. Because it takes a minimum of 600 days for the liver to be able to remove this oil. Yes. Again, the process of manufacture of this seed oil, they use a solvent to have metabolism, enzyme system, and several other issues are compromised. So I recommend you take vegetable oil instead of seed oil. And I'll probably give you one now, nutritional colleagues. One of the best vitamins to heal the internal movement of your arteries is vitamin E. But not the vitamin E tocopherol. Not the vitamin E tocopherol. The one that heals it is alpha tocophenol. And which oil can give you that? Which oil can give you that alpha tocophenol? God bless you. Oil. Genuine one. I take 5 mil 3 times a week. Yes, yes. Alpha tocophenol from palm oil. Then the next one is olive oil. You can get it from olive oil. So it's huge. So the issue optimizing for us to optimize positive health outcomes, we must have knowledge of these nutraceuticals. And when I mean nutraceuticals, I'm talking about all food that have active pharmaceutical compounds, isolated ones, vitamins, minerals, either individually or from food. Once you do that, and your lifestyle, you change your lifestyle and your consumption pattern, you are okay. So the pharmacist is at the core of this. It's at the core. I'm just telling you, why we not do practice. I had an issue with the head of the department of medicine. A patient came in with malignant hypertension. Malignant hypertension. I just want to express this so that you know your position in the hospital. A patient came with malignant hypertension, and we needed to bring the blood pressure down as soon as possible. And the doctor told me he spent on the 30 days, whatever, and he prescribed hydrolysis. You know hydrolysis? To be put in IPF, and I objected. I said, look, you rather give this in an IV bottle over a period of 30 minutes, rather putting inside IVF glucose. He called all these things. He said, I'm trying to disrespect him, blah, blah, blah. I said, no, this is not it. He now said I should bring it. He said, why? I said, the issue is that hydrolyzine will react with glucose, and the product will be ozone, O3. And the O3 will destroy the blood pressure, the blood corpuscles. And from there, you can start having blood clots. And from the blood clot, the patient will have heart attack. You know, so I should give evidence. I just opened to Colloquium, Martin. I went to the section. Contraindicated not to be used in any IV food with glucose. You know what he said? He apologized and said that it's not age that they use alcohol. So, if I wasn't able to do that, the patient will not be able to alcohol. So, like I said, this is a very huge topic. There are several things to discuss next time on nutraceuticals. Yes, there are several things to discuss on nutraceuticals. So many things I would have loved to touch on, but the chairman of the giving me time since. Otherwise, some of them will benefit us individually. A lot of them will benefit us individually. Heavy lifting is about nutrition. The day you start seeing diseases, then let's start talking about pharmaceuticals. Most of them start 15-20 years before whatever symptoms, signs and symptoms you are seeing is not the disease. The disease itself is underlying somewhere and took time to grow. Diabetes is a very important topic. As it is now, do you know we have diabetes type 5? Diabetes type 5. Diabetes type 1, type 2, type 3, type 4, type 5. And the type 5 is one that leads to Alzheimer's. Alzheimer is part of this. And they talk about beta amyloid protein. You understand? So, if we're not conscious of some of these things, there's an issue. There's an issue. One oil that you people should always use from time to time is MCT. They use it to even as an adjunct for Alzheimer now. MCT, where do you get it? Cold pressed coconut oil. It crosses the blood-brain barrier. 60% of your brain is cholesterol. And that is why when the place was starting, you'll be having issues. You are depriving the brain of cholesterol. You understand? And again, starting will also deplete you of vitamin B12. So, where are you? So, thank you so much because time is absolutely against us. I'd like to appreciate